Good afternoon, welcome back. This is Simon Adim. If you haven't met me before, in this video I'm going to talk about care homes, and also I'll clear some of your doubts in terms of care homes, safety for the nurses, and how the nurses can keep their license safe, what are the problems they can face, and whether they should work in the NHS or the care homes. I'll give a little bit of difference in between of both of them, and it will help you decide which way you need to go. All right, so in the care homes, you are given 25 to 30 patients. If you are working on the night shift, usually there is one nurse only to take care of 27 or 20 or 30 patients. But if you are during the day, you may get less patients because of the washes and medications and things like that. But again, for 25 to 30 patients, you will have one spot worker with you as well. But the thing is, the workload is a lot, because here in the NHS you get maximum 10 to 11 patients, minimum 6 to 7. All right, but if you are in the care homes, you'll get 20 to 25 patients per nurse, which is a lot. Okay, the problems that you can get in the care homes are it depends on to the nursing home or a care home you're working in. And it depends. Why I'm saying it depends, that because we don't know how many patients you are going to get. If you're going to get less patients, you will give better quality care. Why I'm saying that, as a nurse, is my job when I go to a patient to assess the patient A to Z. Okay, I need to do A, B, C, E, all my assessment. Okay, head to toe assessment. And for that, I need time. Yes. So if I have 30 to 40 patients or 25 to 30 patients within a 12 hours shift, I don't think I'll be able to manage doing all these. All right. And if I don't do head to toe assessment, I may miss any skin damages, or I may not check the oxygen saturation of the patient. Okay. Or if I don't know, maybe OBS wise, you will see that patient is turning blue, so you will check the oxygen saturation. But what if you are not present with that patient? You are with someone else. So usually it's not like a hallway, it's like a lounge. It's like a hallway, like a lounge. Like in the lounge, you have like 10 patients or 12 patients, and the other patients you have in the other lounge. So what if you are not present at that time when someone was going through an emergency, or there was nobody to look after the patient? So it can get you into the trouble. I would highly suggest, if you can, you can work in the NHS. Why is that? Because you have your nurse in charges, you have your managers, you have the doctors there all the time. So in case of an emergency, the patient can be attended right away. There is no delay at all. So what happens is, if you are in the care home and there is an emergency, so quickly, of course, you'll go to the patient, you will press the buzzer, maybe another nurse will come to help, unless you're working night shift, because usually on the night shift there is one nurse only. Okay, they'll come and help you, but there is one person. If there is one nurse and one support worker, two of you are there. Okay, so you won't have any help. Yeah, so quickly what you do, you check the OBS of the patient, you check if they are desaturating, you put on the oxygen, you call the ambulances crew. Okay, you call for an ambulance, or you call for a GP. Okay, if you can't get on, and when you're calling the GP, it takes time. Sometimes it can take 30 minutes or 40 minutes getting through the GP. All right, in the worst scenarios, in the worst cases, in terms of if the patient is having heart attack, or you may need to call 2222. Yeah, so in an emergency situation, if you are alone, it can get into you it can get you into the trouble. Okay, why? Because in a hurry, you may miss something. As I said earlier, I can't speak today for some reason. because I was just lying down with my son. He was asleep, so I thought, okay, let me go down and make a video since he's sleeping, because nowadays I'm missing a lot. I'm not getting the time to make videos. So now he's asleep, I thought I'll come down and make a video. Yeah, so because when you are rushing things, obviously you will make mistake at some point. I was watching one YouTube video, and the nurse said, because quickly she was calling the emergency ambulance, and then she checked the orbs, everything was okay, and by the time she was calling the ambulance, patient is saturated, and she couldn't remember to put on the oxygen because of the workload. If there was another nurse, maybe she would have just put the oxygen on for the patient, could save a life. So I in my personal experience and the stories I heard from people, I would say working in the NHS is safer, and then you can help the patients in a better way, and you can also do your assessment. You can be a better nurse. Okay, so if something happens in the care home and you were not able to do something, for example, for this nurse, she wasn't able to put on oxygen, it can lead into a trouble. She can be in trouble. I think she's getting investigated for all this. So people may think she's a bad nurse. Maybe she wasn't a bad nurse, but because of the circumstances and because of the current situation, she couldn't think quickly. All right. So we, as nurses, we are also human. We have that human factor. So we can also forget things. But as a nurse, that's what I was saying, always remember to check your ABCs, airway, breathing, circulation. Okay, it is very, very important. E also as well, because if you check the patient, the airway is clear, you are okay. You check patient's not breathing, you may have to call the cardiac arrest team. If the circulation is poor, the blood pressure is low, you may have to call the team, and then you need to act fast. You need to act quickly. Since you are not a prescriber, you are not there to make a decision. You have to call the healthcare professional, a doctor or a GP or the Medisex, not Medisec, I mean the medical help, to get some advice. All right. Also, what I notice is in the care homes, if there is any investigation, it takes long time. It takes forever, and the managers and all of your colleagues must be thinking, oh, she did this mistake, she did that. So maybe you are not a bad person, but in a hurry you made that mistake, right? So in terms of getting help and saving patients, I would say there is more help available in the NHS. I'm not saying that care homes are bad. It's just that what I heard from people. Okay, I have no experience working in care homes, but my colleagues, sometimes they go for agency shifts, or sometimes I watch on YouTube as well. So a lot of people complain about the same thing, that the workload is a lot and then they don't get enough support. Okay, so if you are someone who is new to the country, I would highly suggest you work in the NHS than in the care home. Okay, if you are someone who is very expert or used to work in ED and very quick in taking actions, and then that's your passion to work in the care home or to work in a homely environment, you can go for a care home, and the salaries are much better in the care homes than NHS. As you all know, the NHS salary is low, but you are safe. Your pin is safe. It doesn't mean that you can do anything that you want. There are policies, there are rules and regulation, and that you need to follow. And then if someone is doing something wrong, there are other people, or someone is there to correct you. Okay, you have your band sixes, you have your manager, you have some support, you have your matrons. Even your manager or your band six is not there, you can always call the duty matron. You can always call even if it's at night, you can call the hospital at night. So there is support available if you are not sure about anything. I must say that in the care homes also, the support must be available, but if you know how to utilize it. Okay, if you are new to the care home, then obviously you will need some time to get adjusted. Yeah. So I think for the beginners, for the new starters, it's better to start with the NHS. And when you feel like, okay, once in a while maybe I can do agency shift, I can go out, work in the care homes and see how they work, how is their patient and nurse ratio. There are good care homes as well, good care homes also available there, where they give like 10 to 15 patients to a nurse, which is really good, because you don't the patients, they don't say patients, they say residents to the people who lives in the care homes. So they are not acutely ill. Okay, they are living there because maybe they are having a blood sugar monitoring, or they have any sort of pressure ulcer that they need 2 hourly turns, or maybe that they need some dressing change, that's why they are here, or there was no one available at home for them to be with, so maybe that's why they are here. And that's why, or if they are end of life, or they have any terminal illness that they need to be cared for, or that they want to die in the care home peacefully. So there are different scenarios that there are different conditions, there are different reasons why people are living in the care homes. They are not acutely ill, but anything can happen. Still, at the end of the day, they having some medical issue, they are having some medical problems. So anything can happen anytime. At any time, anything can happen. So you need to be ready, be prepared as a nurse, do a head to toe assessment, check your ABCs, whether you are just giving the medication, look at your patient from head to toe, check if they are okay. Even when you're working in the NHS, you need to be very alert and conscious. Okay, and when you go to the patient, look at the patient, see, are they pale, they looking blue, are they breathing okay, can she answer me, is she alert, is she conscious, is she breathing? Yeah, so these are the things that normal people won't do. You are a nurse, you are taught to do this, that's your job, so you should be doing it, Malavi. All right, so yes, this is very, very important, head to toe assessment. And also, if you are working in the medical wards or in ED or anywhere in the UK, the mental status or mental health of the patient is very important. You need to know whether they are confused or not. Okay, if you don't know whether they have the capacity to make that decision, make sure we assume that they all have the capacity. If we don't know if they have the capacity or not, it's our assumption that yes, they have the capacity, unless you get someone to do the mental capacity assessment. All right, guys, so I think that's all for this video. I was going to talk about care homes only. Okay, and I would highly suggest you go for a better opportunity in the NHS, so you are safe, your pin is safe, and you can work nicely. Okay, you can work as a good nurse. Okay, even in the care homes, there are good nurses, maybe they are like well experienced, and they've been working there for so long. I'm not saying that you are not a good nurse who are working in the NHS. It's just that if you are well experienced, you've been working in the care homes, you can manage it very well. Okay, if someone who is starting their job in the UK, it can be very overwhelming for them to go to a care home and start from there if they don't know the rules and regulations of the care homes, or if they don't know the policies that they need to follow if someone gets sick, or if there is an emergency situation. So I'm just saying that NHS is there is more help available. And then there are better what do you call it, like you are not alone. If you are in a care home, you are alone. Okay, if you need some help, you will be sending an email to your manager. Here in the NHS, you can call the your matron or your manager or your band 6 and ask for help. And here people, your seniors, they are very flexible. Okay, they don't mind you calling them, they don't mind you texting them, so it's very helpful. I think that's my personal experience, and that what I am hearing from a lot of people. I have friends who've been working in the care homes, and they are are now in the NHS, and I'm telling you guys, they feel such a relief when they are here in the NHS, okay, because we have doctors available all the time, we have band 6s available all the time, managers, matrons, healthcare support workers, everybody is there just to help you, and in case of emergency as well. So you are not alone, whereas in the care home, if you are one nurse, you will be one nurse. All right, and that's all for today's video. I'll see you soon in the next video. Till then, take care, God bless you all.